So how do we know if our fees are up to date? Well, you gotta look into this. It's something that we should do every year, maybe twice a year, depending on the dynamic of the economy and where you're located. All of those things matter. It's really important that you get with somebody like Compass or the ADA, or you obtain, maybe your accountant might have something that you obtain a list of some of the fees that exist in and around your area, your zip code. If you do this, you will oftentimes see that you're really far off of where you should be. This is really important for a lot of reasons. One that you might be interested in, doctors, is it's important for your bottom line. Insurance reimbursements, their behavior is dictated by what we do in our fee increases and so on and so forth. So if you haven't changed your fees in 7 years, that's problematic for the rest of us who are doing it on a regular basis to kind of stay in alignment and encourage insurance to do their part, increase what they do in terms of allowables. We also have to be very, very patient-centric and be conscientious of how this might impact our patient compliance to case acceptance and so on. So it's really important that you don't just go in there and increase every fee by 5%. That's a mistake that a lot of practices make, and it needs to have a lot more intention and strategy, and that's something that we like to work with teams on because there is a wrong way to do it. If you're constantly monitoring what's happening around you and what's happening in your practice with regards to fees, then your patients will probably never even notice because you will make small, tiny little incremental increases along the way. And that's the idea. We don't want anybody to feel the sting of a 50% increase, which I've seen before. And that's not pretty. A lot of practices start in like that 40, 50th percentile and think that they need to be in the 80th, and that can be very detrimental and have a negative impact on patient experience and patient retention.